Ted from Par for Success here, and I'm going to talk to you today about how to fix your own knee pain in less than 2 weeks. Today I'm going to talk to you about pain that comes from behind your knee and the structures that you can treat on your own to help reduce that. I want to say that if your pain does not reduce in 2 or less weeks, then I want you to seek a medical provider, as the situation could be more serious. So let's get started. The first muscle that I want you to treat is called popliteus. It's a very small muscle that goes across the backside of your knee, just below your knee. So best treated with a lacrosse ball. A softball can also work, but lacrosse is best. What you're gonna do is place this just below your knee, okay? I'll do this side, and then roll around a little bit up and down, a little bit side to side. If you find any tender spots, I want you to sit on them and breathe. Okay, 10 to 20 seconds, and then I want you to create a little bit of motion. And you'll do that by relaxing your foot to the ground and then getting your foot off of the ground. Relax, get it off the ground, relax, get it off the ground. Okay? So do that 6 to 10 times. The next muscle group I want to talk to you about are your calves. So in your calves, there are actually 2 sets of muscles. One that goes along the outside, those are called your gastrocs, and one that's deep and down the middle called your soleus. To do the ones along the outside, you can use a foam roller or a softball. For today, we'll look at the foam roller. Okay? So what I want you to do is not have your foot pointed straight up, but either to the outside or to the inside, and roll up and down the length of that muscle, finding tender spots. Once you find tender spots, you can cross your other leg on top of it to create a little bit more pressure. Breathe 10 to 20 seconds, and then create motion by pumping your ankle up and down. And you should do that both on the inside and on the outside. Okay? Next muscle is the one down the middle. It's called soleus. For that, we're going to use a softball. So, because it's down the middle, you want to place this right down the midline of your lower leg, in between those 2 muscles that we just worked on. And then it's the same technique. You're going to roll up and down, find tender spots, cross over your leg and breathe into it, and then create motion by pumping your ankle. The last muscle group I want to talk to you about for pain in the back of your knee is your hamstrings. Your hamstrings, much like your gastrocs on your lower leg, are best treated along the outside and the inside, not down the middle. There's a major nerve that runs down the middle of your thigh, so I want you to avoid that area. This is best done with a foam roller on a bench or a stool, and you can roll back and forth all the way the length of your thigh to find tender spots. Notice I'm a little bit leaning to the outside. I could also be a little bit leaning to the inside. And then again, find tender spots, sit on them and breathe, and then I want you to bend and straighten your knee 6 to 10 times. You could have multiple tender spots in the same muscle, so make sure you don't just stop after one tender spot. These techniques should help the pain in the back of your knee within 2 weeks. If they don't, contact a medical professional, or you can contact us for more information at parforsuccess.com.